Don't spend most of your day here. So we are here today in this week to honor our National Community Health Center Week, which for us is probably as close as we get to the Holy Week. Community health centers, but it does a number of things, and one is to honor the over 60 years of community health center movement has been alive, going back to the Johnson administration and the Great Society program. And the war on poverty. So again, Whitney was an early entrant into that, as well as a couple other health centers here upstate. So we have a proud tradition to celebrate this week, certainly. So I want to welcome everyone. For those of you that again don't spend your day here, and we do have some folks that have helped us along the way a lot over time. So Mayor Applyrs here today, Senator Fahy, Assemblymember Gabriella Romero, and Assemblymember John McDonald. So all folks that have been integral in Whitney Young's history, and even with the two that are newer to their roles, they got on board pretty quickly. So we are delighted to have them in the fold here as well today. So just a little bit about the Community Health Center movement, and then I'll move on. So here in New York, we care community health centers, the 75 or so that we have. Most of those are downstate, but I think there are now about 18 of us that hail from north of Ulster County. But across the state, we care for about 2.5 million people in New York State. And if you look at the where people that are enrolled in Medicaid get their care across the country, 1 in 6 Medicaid members now get their care in a community health center. Over 50% of patients cared for at a community health center are Medicaid enrollees. And so obviously with that not so great, beautiful bill, that will have a little bit of impact on that. And that'll be fodder for a talk, I think, tomorrow that we're going to do through Health Center Week. So we won't belabor that one today. So this year's theme for National Health Center Week is building innovative care where it matters most. And that's a nice slogan, but I think what we would like to highlight here at Whitney Young is innovative care is not just about technology and how well we implement that. It is about the other things that we strive to do, and that is really about integrated care and our ability to integrate. So not to co-locate, but to integrate. And so when we treat people at Whitney Young, we are treating all parts of the body. We are not segmenting that. We are including everyone's issues regardless of what they present with and where they present to us. And so that is a hallmark of what we're doing. And I think the other component of this innovative care is what we have the opportunity to do as a safety net provider in building the workforce, because we know that it is incredibly shrinking in terms of the healthcare professionals that are not only entering the field, but those that aren't staying so much post-pandemic, and for those that have decided to take maybe an early exit. But getting folks to do this work and kind of embracing it the way they have for a lot of those 6 decades that community health centers have been around is a challenge. So that is part of what we're here today to talk about, and our ability to shape the workforce as we go forward. So I think the really exciting piece we have to talk about today, and the great work that our electeds have helped us do, is really about how we use this space that we developed about 8 years ago now to help us train the future dental workforce. So we're not just talking about dentists, but we're talking about dental assistants, about hygienists. And so one of the things that we've been a little bit lax on this side of the river over the years is really having training programs that speak to the dental hygiene and to the dental assisting side. So that's traditionally happened in Hudson Valley, but there's nothing that precludes us from having folks cross the river and do their immersion here at Whitney Young and helping them grow their skill set, and ideally to look at this as a place where they can make a nice career for themselves down the road and help continue to serve the safety net. So that is what we're doing here today. We'll be celebrating the work that we will have ahead of us now to develop the space in the basement of this building that will allow us to get the non-patient facing components of what we do in the dental practice downstairs, and allow us to kind of expand that training. So both with the assisting and the hygiene programs with folks that do the clinical rotations here, but also teeing up so that on July 1, with a dental residency training program, that those residents would start here in July of 27. And so we have some applicants now for to be headed for that program to start here in July. So I tell people when I left here 25 years ago to head to Maryland for a 20-year run. I remember we had 4 dental residency training programs in the Capital District, and we are down to 1 at the VA that is locally controlled. And so this is the attempt to kind of get that back in this mix, because we do know when people go through these programs, they will often stay for a few years to be able to apply their trade here before they either fall in love and move away, or someone lures them away for some other reason. But we know that really works, and it works around a lot of community health centers that do take on the teaching aspect. So that's really what our goal is and what we're hoping to accomplish here. I would just highlight, over the years, there's been a number of people that have gone through Whitney Young in a training capacity. Assemblymember McDonald's a prime case in point. I think he counted a few pills here back in the day and probably assessed a few patients. It is formative years, so and he stayed around. So that's good.
And then I fell off.
Yeah, was like a host. I'll highlight another one from the dental world. So for those of you that remember him when he was a state dental director, but Jay Kumar, who actually worked here at Whitney Young, ended up at the OH, and I think just retired more recently as the state dental director in California. So we've started some good things here. It wasn't only the Leland Stanford family that moved to California to do good things. We also have other people. So that's what we like to be a part of, and to like to shape that workforce agenda as we move forward. So before we ask our invited guests to come up, I just want Dr. Rothfuss, our dental director, to share her comments and her reflections on what we're here to do.
Hello. Thank you so much for joining us on this momentous occasion during National Health Center Week. And thank you, Dave, for the generous introduction. I'm super excited to be celebrating this milestone during Health Center Week. The public is now understanding the critical role that oral health plays in caring for their overall health, but access to oral health services continues to be a challenge, especially in the New Yorkers living in the capital region. Part of the challenge is an absence of a pathway to draw dental professionals to the area. And so it was very important back in 2022 when we started this journey on establishing Whitney Young as a educational center, that we find ways that we could be part of the solution to bring health professionals to the area, whether it's as dentists, as dental assistants, as hygienists. And so we're not in the proximity of a dental school, and the number of dental residency programs in the area continues to dwindle. This investment by our local legislators in partnership with Whitney Young to build a state-of-the-art hands-on facility will put our residency program and our other dental educational programs on the map by providing a unique simulation environment for dental residents, for our dental assistants, students at Hudson Valley, and our dental hygiene students from Hudson Valley, to hone their hand skills and gain critical input from their faculty to ensure that their patients are receiving the highest quality of care, and all of our students and resident trainees are receiving the highest quality training experience. This training facility will further enhance our mission to develop oral health care professionals that are prepared to collaborate with their primary care colleagues to provide culturally sensitive, patient-centered care for medically complex patients, and who will serve as oral health advocates in their communities to continue to fight for health policy and funding that helps address access to care and the health provider shortage in this area. According to research conducted by the Health Resource and Service Administration, 86% of residents who complete their training and postdoctoral training in an underserved area community health center end up staying to practice in those underserved communities. And we hope this endeavor will provide the same pathway for the New York Capital Region. So thank you all for being here. Thank you to our legislators for this generous donation for us to take our residency and our educational training programs to the next level, and really draw people and put the Capital Region on the map for healthcare training. So thank you. And I give back to Dave.
So as we mentioned during the last legislative session, our three electeds here that are spending their time in the New York State Legislature were very generous in pursuing on our behalf some support so we can make this thing happen. And so I want to give each of them a chance to reflect on what that means and the work that they're doing and the things that are important to them in their constituencies. And then also I want to give Mayor Applyrs an opportunity to share her perspective from City Hall. So I think we're going to kick it off with for Roberta. So Fahy, yeah.
I'm laughing because we used to go back and forth with the 108th district versus the 109th, but I guess I can't do that anymore. This used to be the 108th district. It's wonderful to be here with all of you. I feel like it always sends me down memory lane because the first time I came here was with the refugee family that began mentoring now almost 20 years upon. It was my, and I saw what an impact it had in that family. We had virtually no language skills or English skills, I should say. And so it was a wonderful way to I'd heard about you and read about you, but when you see firsthand the impact that it makes on a family, it really just hits my heart. And David, we are so glad you came back from Maryland. We're such a force. And I also learned from John McDonald that it's one call you always take or a text you always return because these issues are so hard fought. Mm-hmm. And I am glad you mentioned the big, beautiful bill because the safety net that we all know is so essential to more and more people, right? That net has just got holes in it all over, and the holes are growing by the day. Since the big, beautiful bill was signed just over a year ago, this morning I'd be remiss if I didn't talk about just the latest rulings from the Trump administration that is just going to devastate the direct care or the human services, the workforce, with thousands of, in this case, particularly Haitians who will be losing their jobs across this state and right here. So it's just every bit of healthcare is really being pummeled in so many ways. I am proud to live in a state. I feel like I say this every day. I'm so proud to live in New York. I'm so proud to live in a city and I'm looking at the mayor here, to live in a city that is a welcoming community, a state where we are continual advocates to try to backfill and help, but the billions, we can't replace it. So I just thank you for what you do. We have nothing but admiration. I will say my last 2 years in the Assembly, it was in so many ways the highlight of my years in the Assembly because I served as by right chair. Banged my head against the wall a lot on the professions and really began to learn more and more about dental care. And, the research is quite profound about how good oral health care or dental care is so integral to good health care. We used to we still treat them separately in this country, and yet it is so essential. I'd be remiss if I also didn't give a shout out to Carrie Warner, another colleague and Amy Paulin, the Assembly Chair of the Healthcare Committee, who really have championed doing more on dental care. It's been frustrating, so I'm proud to carry one of the bills with her, the Dental Desert Relief Act. But it's been a struggle to move a number of bills with dental care. As the numbers keep mounting, I hope we will do a better job. In the meantime, I'm always honored to join my colleagues, Assemblywoman Romero and Assemblymember McDonald. These are the easy discussions on where to give what limited grant dollars we are able to award. I really hope that what you are doing, in the end, we got to grow our own, right? We've got to grow our own. So I'm thrilled with your innovativeness. We talk about innovation, but your innovativeness in trying to solve the problem for the long term. And I'm so pleased with the new leadership at Hudson Valley. I'm sure they will continue to be a great partner. So again, I'm just honored to be here and to be of some tiny help to the work that each of you do each day. I have nothing but admiration. Because you don't work at a place like Whitney Young without having a personal passion for those you serve. So thank you.
Thank you. Well, because they work at different times. So we have two of our dedicated folks with us today. So Tracy Johnson, who's been on our board, I think, now it's about 3 years. And Nate Gardner, who is, I don't know, work out of European stars. Also knows our work a little bit because Nate leads the PA program over at Albany Mid. So with that, I'm going to call up our President of Healthcare Profession in the Legislature.
Good morning, everybody. And David, thank you, and to the team at Whitney Young for the great work that you continue to do. And it is true. 42 years ago, I was downstairs with Dr. Peter Mock in the pharmacy. And yeah, that's before you were a twinkle in your parents' eyes. And a fair amount of others around here too, I can tell it, right? Not you, Pat. But anyway.
You knew that was coming. Thanks, John. I can always count on you.
I wonder why she left you assembly.
Oh, yeah. Yeah.
So, but the other, and it was interesting because of the time. It was a great experience for me. You know, you do rotations to community pharmacies. I went to the VA actually, did another hospital stint, but this was a little bit of a unique experience. And Dr. Mock at the time at Whitney Young were so cutting edge. That's when they were actually doing their own formulary. They were actually using automation. And bottom line is that I don't think it was a luxury, it was a necessity. In other words, to provide these services, you have to use every tool and every person to their almost level, which I think is important. The other thing I want to mention too is we are here in Albany, but I'm also very fortunate because I represent Troy and Waterville. You know, we have Whitney on sites, obviously in Waterville and Troy, and it's great to have that type of access and service to our patients. It's great to partner, of course, with Assemblymember Romero, Senator Fahy. And it's true. It seems like every August we're here for National Center Health Week, talking about many different issues. And honestly, unfortunately, because of HR 1, there's a lot to talk about. Early this morning, I was on the phone with members of Houses of Representatives in red and blue states and senators in red and blue states as we're trying to work on making some changes to SNAP benefit changes, which, what's that got to do with this? This has a lot to do with this because there are going to be people who are going to be going without food. And it's such a perverse thing that they did. I don't think people really realize this. You know, there's always a natural error rate when it comes to the SNAP benefit. And it's incumbent upon all of us, because it's taxpayer dollars, to make sure the program operates efficiently. But at the same token, when the federal government prohibits giving you the tools to do it, it's hard to actually comply. And in a very perverse way, they actually reward and benefit those who have error rates of 25, 35, 40%. Like Alaska. It doesn't make sense. I have nothing against Alaska. It's a beautiful state. Meanwhile, New York State, which, you know, we passed in this budget enhancements to improve the efficiency and accountability of the SNAP benefit because scammers are stealing food benefits from people. It's not that people are signing up and getting it illegally. Innocent people are going into the store, and scammers are able to place their phone over their phone and take their data and exhaust their benefit. We're trying to correct that, and we're going to get punished for doing that. So it is a very odd time in many aspects, and we have to respond to it. At the same token, it doesn't mean that we can't still find ways to help our community partners. And that's why I'm pleased to support, along with Gabriella and with Pat, a total of $400,000, $200,000 coming from the 108th Assembly District to help create this new dental teaching center. I've been blessed to work with David for the last 14 years with Pat as well. And it seems like there's always the next shoe is dropping. And I remember when St. Peter's had decided to close their clinic, and we were extremely upset. And I was, my cousin's a dentist. I know the work that goes into dentistry. I also know the lack of access to care is a challenge, but I also know, as Had alluded to, dental health, it plays such a critical role in overall physical health, and it can't be underestimated. It can't be, reinforced more. So we're very fortunate. We have a speaker who really gives us a pot and says, here, your communities better than I do. Find out where you can make a difference. I know, partnering with the team here at Whitney Young, led by David, that and governed by a great board, that if you do God's work, just to be very clear, I know that this type of investment is going to be well utilized and well spent. So it's a pleasure to be here, and thank you as always for your continued great work.
Before I ask Assemblymember Romero to come up and share her thoughts on the work that we do here and her phenomenal work in the Assembly, I'd be remiss if I didn't probably talk about how close to home your comment is, in that we know firsthand of folks that came to this country from Haiti to do good work, and unfortunately had to go back. This program is it here. It's a little bit touch gears. It's full circle.
Thank you.
So with that, I do want to again thank the three of you for your collective work, and I think it was Assemblymember Romero that we met with first when we were doing the rounds, and so I think she was the one that was the fulcrum to get this back uphill that we needed to get uphill. So thank you much, and stay easy, brother.
It is really wonderful to be with everyone here to celebrate this really momentous investment. And we know that Whitney Young is a long-crested community partner. We know that oral health is an essential part of overall health, as everyone talked about. And I'll just say that meeting, when I first started the Assembly 2 years ago, I know I'm the baby at the 30. I'm 33, the record. But when I first got into the Assembly, I made sure that I was welcomed and by open arms with all the groups, but made sure that I reached out to the groups too that I didn't know a lot about. I was a public defender before I was in the Assembly, so I know a lot about the criminal law. If anyone gets arrested, let me know. But I know a lot about healthcare, and so my mouth was called ACEs, Adverse Childhood Experiences, which means that they're more likely to commit criminal acts when they get older because they're not going to school, and that cycle perpetuates negative activity in school and in New York State. And so I see this investment as an investment, obviously, in oral health and in physical health, as is mentioned, but also in like the safety and beautifulness of our communities as well. It all starts in our mouth in a lot of ways. And so I'm excited to be a small part of this investment. I hope that it can spur a larger conversation around dentistry as well. When you were telling me about the bills and the holdups that we had, I went and talked with some of the sponsors of those bills about ways we can increase access to dental care. It was very frustrating to learn why we are not moving some of those bills, why we can't get access to more dental care across New York State.
shocker, has a lot to do with big money and people not wanting to share the scope of practice. But it's a competition for another day, I think. I just want to say I'm a partner, although it's not my lane, so to speak. But everything is all connected, and I'm really proud to be a small piece of this puzzle. And looking forward to partnering again in the future, maybe with more money, but also with more legislation. So thanks for having me.
These podium jokes keep coming. But this is the right height. So just want to say good morning. I think it's still the morning, everyone. And my job really is simple in terms of cleanup is really to say thank you to our colleagues here. It is truly a breath of fresh air to work with individuals who just get, oftentimes we are in these spaces and there's no education needed for how to treat people with care and compassion and dignity, and influence legislation that enforces just seeing people as human beings and treating them as such. And also, in addition to the legislation that you all influence, but also putting actual dollars towards investing in people. And that's truly the work that we are into, and that's investing in people. This is public service, and if you're not investing in people, then what are you really doing in these seats? And so I just thank you all for the investment in Whitney M. Young, and I get to thank the team here at Whitney M. Young. David, thank you. You reached out to me. The phone call can... And it was an invitation to join you all in your efforts to raise dollars. And I did not hesitate. One, because I was someone who started my career doing HIV/AIDS work in this community on Clinton Avenue. Whitney M. Young was talked about constantly. It was a place that people knew they could come when they needed help and health care and support. And so my entire career, I have always heard about Whitney M. Young, always in a good light because of the work that you all do. So I commend you all for staying the course. This is not easy work. And so with a public health background, just because it's the right thing to do, people don't always do it. And so you all are really good. If rubber meets the road, you do the important work. So I say God's work. And lastly, I'll just say, as it relates to the pipeline, in terms of the workforce, as I was transitioning from high school to college, my mother said, you need to get braces. She was not really pleased about the teeth that were growing in it. I don't always have a big check. But I am always proud to be able to declare a day or a week. And so as mayor of this great city, I do hereby proclaim this week, Sunday, August 2nd, 2026 to Saturday, August 8th, 2026 to be National Health Center Week here in the city of Albany.
All right, so we probably would not be doing justice if we didn't vacate your view.
Anyone else from the team? Ever? Board member, representative, excuse me, we are Dr. Yes, yeah, I just, yeah.
Wow, that's great. Got the memo.
You don't ask, you don't catch, folks.
That's very honest.
No, you know how the Senate is. They're all up like this.
Do you have a board member representative? Yes, but I thought of less. Here's it. Could have done it. And always had what's affected. Yeah, the cat's on the truth, and I can move. All right, so hard done thing yet. It's really board members. Yeah, Matt. How much? Was you so sure? How
about you do though?
the gentleman?
They'll be your molars.
But then put
You truly.
down.
The impact that it makes on a family. It really just hits my heart. And David, we are so glad you came back from Maryland. You were such a force. And I also learned from John McDonald that it's one call you always take or a text you always return because these issues are so hard fought. And I am glad you mentioned the big, beautiful bill.
It was a great experience for me. You know, you do rotations of community pharmacies. I went to the VA actually, did another house posting, but this was a little bit of a unique experience. And Dr. Mock at the time at Whitney Young were so cutting edge. That's when they were actually doing their own formulary. They were actually using automation. And bottom line is that I don't think it was a luxury, it was a necessity. In other words, provide the services, you had to use every tool and every person to their utmost level, which I think is important. The other thing I want to mention too is we are here in Albany, but I'm also very fortunate because I represent Troy and Watervliet. You know, we have Whitney Young sites, obviously.